Now I can see.
Yeah. So yeah, just before going into the session, can you just tell a few words about yourself?
Sure. My name is Vandana Cha. I'm doing this yoga from last 10 years. I have experienced trainer from RYS 500 Yoga Teacher Training Course, international course. I'm a certified yoga for the 100 hours pregnancy yoga as well. So I know about the pregnancy, pre-pregnancy, post-pregnancy, and everything related, infertility issues, everything. So overall, I'm a nutritionist as well, so I know the nutrition benefits and things.
Okay. So yeah, today why we came live? You must be like curious about what are we going to do today. So today she will be telling us some techniques and some she'll be demonstrating some asanas so that we can live a healthy life, something like that. So I think we can go directly into this session, can we?
Sure, we can. Actually, my plan is in this pandemic, everyone wanted to know some basic exercise. Who people are flexible, not flexible, they can do exercise or not. But everyone want to do in this pandemic exercise, some pranayama, some breathing warm up exercise things. So they can utilize small thing and they can boost their immunity level. So because of that only I wanted to share some basic exercise which everyone can do with if some they have some physical challenges. In that case also they can do that asanas and make sure their body is little healthy than regular one.
So these asanas are helpful during this corona times you're telling, right? So we can
Right. This time because if people are suffering a little bit, see previously cold and cough is not a big issue. But now if one person sneezes, people start worrying. So why this sneeze going to stay for 3 to 4 days? Let's finish it one day or 2 days. So if you do workout, some breathing exercise, so small cold and cough, which is exactly not related to corona, so that it can cure within 1 or 2 days. And then, like if some person is exactly come in contact with the corona positive people, in that case also your immunity level is little better than them. So your survival chances is little better, right? Even I saw some videos. Doctors are providing yoga session, yoga therapy to their corona positive patients. So they get like some energy level and their breathing will be little better than regular. So breathing exercises are that much important. So that's why I wanted to share some breathing exercises as well.
Okay, sure.
Okay,
You can start.
so today shall I start now with exercise only?
Yeah, I just want to ask if anyone in the live wants to join us again with us. Along with us, you can also do with us. So if anyone wants to join, you can join. Anyone interested can send request in to us, and I'll allow you, and then you can also join with us. We can start in another 2 minutes. You
Sure,
can
we
tell
can.
me. Okay, so I'll just tell about her. Actually, from I know her from November last year. She is like a strict coach, but still, when she's a very bit friendly too. But when you're not doing exercises, she won't leave you at all. Come on, continue. She'll give a lot. Like she's a very good inspiration too. And last year, I lost around 10 kgs in one and a half month. But yeah, that's all because of her only. And I just left because of some health issues. So again, I'm joining. To the same coach means you can trust me how like how inspiring she is. And yeah, I think no one is free. Someone has asked Vishal Diman. Okay, okay, I just invited them. We can start our session now. Okay,
Sure.
I will also
We
try
can
to
start.
follow you. Yeah.
Okay, let's start. Let's start with some breathing exercises first. Is it?
Okay.
Okay. First, for the breathing, you have to sit in a comfortable posture. This posture is called Sukhasana. Anyone can sit in this. But if some people are not, they have knee injury, they are not able to sit, they can sit normal. If they want, now not able to sit like this also, in that case, you can just spread your leg and sit.
I can see your leg.
Okay, I have to adjust my camera, I guess. Now you can see?
Yeah.
Okay. So if normally you can sit in Sukhasana, if not possible, you can sit in a normal way as well. And even the old age people who cannot sit like this also, they can sit in a straight chair, not in the sofa, okay? Because in the sofa, your spine will be curved. That is not important. Your spine should be very in one line. Then only you can take breathe properly and the breathe will be go your complete respiratory tract. Okay. So for first sit in a Sukhasana. This mudra, Dhyan mudra, it's very much important to take mudra because while doing pranayama, if your hand is engaged with Dhyan mudra, so your brain is also concentrate with your breathing exercise only. Okay, so we'll start with the Bhastrika Pranayama. First Bhastrika you have to do here. Forcefully inhale, forcefully exhale. Inhale, exhale. See, this is Bhastrika, normal way people can do. Who people are very much healthy, they can do in a very fast manner like this. In that way, it will help you to heat up your body, charge up your body, ready your all, help you dilute your blood. In that case, if people having blood clots, thick blood, in that case, yes, you can do this. So this will help you to dilute your blood circulation. So this will help you with them very fast. But yes, at the same time, hypertension people, high blood pressure people cannot do in this fast manner. They can do in a slow manner. While taking one deep inhale, your lungs feel the full of air, full of oxygen, and then while exhaling, exhale all the toxins. So this is the pattern you have to do with the Bhastrika Pranayama. Will do?
Yeah.
Inhale, exhale. Here we can do little fast. Start. Here you have to follow certain rule. You can practice initially in 120 times. In every second you have to inhale and exhale. Forcefully inhale, forcefully exhale. 120 times. Well, normally if you started with the first day, try to do at least 60 times. And yes, the same time, if you are a hypertension patient or high blood pressure, in that case, you can do 1 second inhale and 1 second exhale. 30 times a minute. Any pranayama helps you at least 3 to 5 minutes. Because 3 to 5 minutes, it take time to at least your body should accept that like you're doing something. Initially, yes, some people feel headache because you're normally not doing any breathing workout, any breathing exercise. So initially you feel like little headache. But that is completely normal because your blood ratio is and your blood pressure is increasing without this fast inhale and exhale. So little headache is normal. But yes, if you feel major, so trying to do slow is very slow. If many people having like little migraine thing, so they get headache very easily. So in that case, you try it with very slow manner. So you feel this breathing and your body get used to slowly, slowly, and slowly you can increase your count, increase your time, and increase your regular. So this is the Vastrika Pranayama, which has helped you to dilute your blood. It's good for increasing your lung capacity. It's helped you to increase and boost off your oxygen level in your body and in your oxygen level in your blood. Second pranayama will do is Kapalbhati. Kapalbhati is one of the best pranayama to cleansing your body. This pranayama helps to clean your all kind of unwanted thing which is comes from outside. Means any dust related things, indigestion something, when you eat something which is not suits your body. So Kapalbhati will help you to eliminate that thing from your body. Only pregnant women should avoid this practice. And yes, any girls in their cycle times or their periods time, they have to avoid it because it's related to your stomach, abdomen. So when you have pain in your abdomen, in that case, you cannot. After like other, all people can do only hernia, ulcer, any stomach cesarean things, stomach related. If you have a operation things, operated stomach, in that case you have to avoid. Otherwise, all age people can do this. Kapalbhati is very best pranayama for digestive system, diabetic patient who's having all the time constipation issue. Constipation nowadays very common because people are eating junk. Nowadays, Corona is there. No one going to eat outside. At home, they prepare so much oily food, so much this white maida, these things. So that at home also you eating junk very nice. So in that case, Kapalbhati will help you to eliminate the things. So in Kapalbhati, stay sitting posture, which is like comfortable with you. Both hands, say Dhyan Mudra. Here you have to inhale only one time. Only one. Inhale actively, then continue exhale. Here you have to only exhale. No body movement. Many people are doing Kapalbhati like this. They start like this and finish like this. So this is the wrong posture. You have to stand. You have to, your spine should be very straight. Only nose movement. Yes, abdominal movement. It's a by default. You are not doing intentionally stomach in and out, in and out. No. When you exhale forcefully, your stomach will go inside by default. And passive inhalation is there. You no need to inhale. If you inhale and exhale, that's become Bhastrika. That is not a Kapalbhati. Many people are doing like this, Kapalbhati. That's the pranayama. That is a different pranayama, and this is the different. When you're doing Kapalbhati for cleansing your stomach, reducing your abdominal muscles, it helps you to reduce weight as well. So this is the best pranayama, which is help you to reduce your belly fat. So here you have to only exhale. One time active inhalation and exhale. One second, one stroke. Normally people can do. Who people are expert in this? If you practice for a longer period of time, then you're very nice in the pranayama. In that case, you can do twice exhaling in 1 second like this. That is very active. So you have first practice 1 second, 1 exhaling. If nut is also not there, you can try 2 second, 1 exhale. 30 exhalation in a minute. For here, just try to focus when you feel breathless. Many people are feeling breathless after 10 breaths like this. 10 breaths, they feel breathless. In that case, what they are doing, they again inhale. Again, don't do. You have to exhale till the time when you are completely breathless. If you're not feeling like the air is coming from your nose, no issue. You just do like this. In that case, your consistency will be there. If you wanted to like forcefully exhale from nose, that time also every time you will stop every 10 X stroke, so you will not going to be consistent in this. So try to exhaling as much you can do with a not exhaling from your nose. That is also fine, but still the consistency should be there. Okay, we'll repeat this pranayama at least for 1 minute. Both hands, dhyan mudra. Inhale, exhale. Relax. Okay, because here I don't have that much time, so I'm demonstrating only 1 minute all the pranayama. So this is the and benefit of Kapalbhati is extreme. Like so much benefits are there. It helps you to reduce your infection things like any infection if you have in your body, not in a stomach. Okay, if anything related to the stomach problem you have, in that case you cannot do Kapalbhati. Yes, it's very good for stone related problem. If you have any kind of stone, if you do Kapalbhati, it's clear your digestion system. So if you have any kidney stone, that stone can be eliminated from this Kapalbhati practice. Gallbladder stone, of course, is there is a no cure of gallbladder, but yes, in that if you practice every day Kapalbhati, you are not going to feel the more acidic thing. You will not feel the constipation frequently. In that case, the gallbladder stroke or the stroke is also going to reduce. So this Kapalbhati will help for the digestion system, like people who taking for diabetes insulin. So this Kapalbhati help you to create insulin from inside. It will give you so much muscle pressure on your stomach. So it helps you to create insulin as well. So these things will help you, and so many and other so many benefits are there. If I'm going to mention it like make a one book. Okay. So now we'll go for the next disadvantage. Yes, I'm already told. Any operated, like stomach related problem, if you have hernia, ulcer, stomach infection, in that case, you have to avoid this thing. And during your cycle, your period days, and in pregnancy, have to avoid this pranayama.
This one is also useful during corona times. You know, it will exhale out that virus, maybe.
Yes, because I heard so many from the doctors as well. The corona chances comes in directly to both two areas, one in the lungs, another in stomach. When it comes in the lungs, of course, it's going to create the full fungus and full this bulgum. They have to create the bulgum on their chest. In that case, you're not able to breathe, your oxygen level decrease. So in that case, the lungs, I'm already at the one like pranayama, that Basrika will help you for that. If this, that comes in your stomach, in that case, if you do Kapalbhati, it's going to eliminate from your urine or your poops. So this will be out. Of course, this will help you a lot. Any pranayama will help you in this corona period, because people are very much running for their physical outer body. They are not bothering about the inner body. Pranayam, they think old age people have to do pranayam. See here, doctors are suggesting for kids doing pranayam. My son is 3 years 9 months old. He's doing pranayam. because I'm introducing in my family pranayama because I know pranayama is how much important. If I put on something outside, if my arms is not that healthy and spaces, I have fat in my arms, that is fine. At least my lungs is good, my stomach is good, my internal organs is good, so I can survive easily. Right? So that's the pranayama is much more important than the physical workout. I'm not saying physical workout don't have to do. Yes, you have to do that things as well. But yes, breathing is most important because breathing, like every breath you take, it's in your life. Okay? When the breath ends, life ends. People have to know this thing and give importance as much they are doing importance to their pranayama breathing. Sorry, their as much important they're doing their normal workout, gym workout, other things, fitness, the physical fitness, they have to give same importance to their internal fitness, their lungs, their organs as well. Okay, then I'll go with the next last pranayama, the third one, which is help you to create cleansing your respiratory tract, this area. When any germs, any related things comes in your nostril, it's going to stray. It's your nostril at least 3 to 4 days. So if any one person who's doing this pranayama, it's called Nadi Shodhan pranayama, and many people know that's a Anulom Vilom pranayama as well. So this pranayama will help you to cleansing your nostril things, respiratory tract, any germs or any corona thing just comes. So that time, if you do every day Anulom Vilom, maybe sometimes it comes, RS go by default. You don't like have to bother. Yes, you gave you contact with some corona people or not. You don't need to bother. If you're doing pranayama, if you're doing Nadi Shodhan pranayama every day, you have to be very healthy. Doesn't mean you have to go freely outside and meet everyone. Okay, don't check your immunity like this. Okay, don't many people say no, I'm doing pranayama, so I can go and freely. Maybe you're not going to infected, but if you got some infection, you can be a communicator. Means you go and you just pass that bacteria to your loved one. Okay, so don't do this. You have to stay at home. Be safe. So we'll do the last pranayama, that is Anulom Vilom. In Anulom Vilom, we have to do with the right hand. Left hand should be in Dhyan Mudra. Right hand in the Nasika Mudra. This middle finger and this ring finger should fold. Sorry, this two finger, your index finger and middle finger, sorry, your index finger and this finger is fold, and these two fingers is active. Here you have to close your right nostril, inhale from your left. Close your left nostril, exhale from your right. Again inhale. Again exhale. Here you have to do deep inhalation, deep exhalation. This will help you to open your both nostrils. And this is meaning of this mudra because this our 5 fingers are related to the 5 element of our body. This thumb, fire, air, time, space, earth, and this is water. So when you're using this two, if people are know, our right nostril and left nostril is also belong, like right nostril is belong to sun, left is moon. So while using this, we are attached this fire to sun and this earth to moon. So this will help you to balance our body element as well. So that's why we are using these 2 fingers. Okay. And while doing this will help you to cleansing your complete respiratory tract and complete this area. If any cold cough, if you feeling any kind of small cold cough, in that time, if you do Nadi Shodhan Pranayama, you feel instant relaxation. Yes, in that case, some people are, their nostril is blocked. In that case, you have to open your nostril first. How you are going to open? If your left nostril is blocked, right is open, try to close your right nostril, exhale from your left. If your left is open, right is in, close your left, right, exhale from your right. Make sure your both nostril is open, then you can practice this pranayama. Benefit of this pranayama can help you to focus. This pranayama will help you to reach out the oxygen level throughout your body. That is helpful. This is very good for your all facial muscles to get oxygen very nicely. And disadvantage of this pranayama is almost no. Everyone can do, any age people can do. Kids, it's very nice. It's very best to introduce a pranayama like a Anulom Vilom to your kid. Who kids are not focusing their study, if they practice Anulom Vilom, they much more focused than normal one. So this is the one of the best pranayama which anyone can do or any age people can do. Yes, the same cause if you have high blood pressure and high BP, in that case, you have to do Anulom Vilom also in a slow manner. You cannot do any breathing exercise in hyper level. You have to do very slow. Will practice. One hand, Dhyan Mudra. Left hand, from right hand, this index finger and middle finger will close. This two fingers is active. Right nostril, close with your thumb. Then inhale from your left. Now left nostril close from, now exhale from your right. Again inhale. Exhale. Relax. Okay, this pranayama, of course, it gives you so much mentally relaxation. If people are suffering for any hypertension, mental issue, nowadays people are work from home doing, and that is work from home. It's very much headache. Because previously, what happened when you're going to your office, you meet people. So you communicate, you seeing each other, feel relaxed, and that time you're doing work, your work are limited. Once you reach home, you have your own family, no work. Nowadays, nothing is happening. The same, you start your office morning, if 9, it's end up with the 9, 10, 11 sometimes. So the work hour is increased 8 to 9 hours, and now it's increased 10 to 12 hours. So, and the work pressure is also too much. People are not seeing each other. They all the time in the phone call, meeting call, or the call things is increasing a lot. That give you so much mental pressure. That's why many people of my client they always ask me for meditation. Previously it was not there. They are doing their pranayama exercise. They never ask for meditation things. But nowadays so much their depression is started because the work schedule. So they always ask for meditation. I'm always adding meditation session for 15 minutes, 20 minutes because of this. And many of my friends will always message me like text me or call me all the time. Now what we have to do for the stress management? Because the stress is increased very badly nowadays. So this one of the best pranayam to balance your stress level as well. Of course, this is not a substitute of meditation, but yes, it helps you to reduce and it helps you to balance your stress. Okay. Then we'll start with some exercise, physical workout, which is exactly good for any age of people who wanted to do. They can do, even kids can do this exercise. Yes, that exercise I'm going to add. Okay, we'll do the standing exercise only. Let me adjust my camera. Now you can actually see me. From here. Maybe some connection issues there. No, I'm not able to see you actually.
We can start, no? Can you hear me,
We
Vandana?
can start.
Yeah.
Yeah, I can hear you now. Okay. I'm going to add some few warm-up exercise first because any exercise, before exercise, you have to do a little bit warm-up. So warm-up, you always start with the neck rotation. You just stand in a normal sthiti, normal standing position, and start with your neck rotation. Okay, start like this. Inhale, exhale. Again inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. 5 times up, 5 times down. And down. Now side one, inhale, exhale. Again inhale, exhale. Again inhale, exhale. Inhale, exhale. Same, you have to repeat 5 times each. Many people can do, they want to do circle like in head. They do complete circle like this. Wow. Right. But many people feeling neck pain while doing this complete circle. In that case, you do only half circle. Touch your chin from one side. Another side, again inhale. Another side. Same this rotation, at least 5 times one side, 5 times another side. Are you able to see me properly?
Yeah, I can.
Okay, good. So this is the neck rotation exercise. And then we'll do wrist rotation, hand completely straight, thumb inward, lock your finger, then do circle. This 1, 2, 3, 4, 5. Anti-clock 1, 2, 3, 4, 5. You can increase the count gradually. When you're doing a regular exercise, you can increase 5 to 10 as well. Hand, both hands here on your shoulder. Now do shoulder rotation. Same. First inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Again inhale, exhale. 5 times, then 5 times anti-clock. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Relax. This also you can increase 10 to 15 times. Then waist side stretch, leg little apart, 1 meter distance at least, not more wider. 1 meter is enough. Hand here firmly. Many people are holding like this and doing this. So don't do that. Hand should be very firmly. So when you turn, you feel the stretch. Hand here, feel, exhale. First inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhaling and exhaling is important because while doing inhaling, while doing any physical workout, if you inhale, you're going to increase your lung capacity as well. So this will help you to reduce the side stretch and help you to reduce the side fat as well if you do the repetition at least 10, 15 or 20 times. 20 times one side, 20 times another side. It helps you to reduce this side fat. Okay. Now the next one, leg little spread, hand little side, left complete side stretch. Here inhale, exhale down. If you're able to go complete down, fine. If you're not, you can hold here. But don't give so much pressure to your body. Down, then again inhale, alternate side, exhale down. Again inhale, switch, another side. Inhale, another side, exhale, like this. This you can repeat at least 5 times, 10 times, 15 times, as much you get flexible, you can do. At the same time, what is age category you are? If you are more than 50, sorry.
In the beginning, even I found it difficult to do this one, but now I'm able to do this on both the sides. I told like if you practice, you can.
Right. When you or like regular with your practice, you can do all exercises and everything is easy for you. At the same time, yes, age categories matter. Any exercises between 20 to 30, very fast manner, extreme, hyper manner is not exactly good. But yes, you can do a little faster than regular one. But yes, if you cross 30 to 40, reduce little speed. 40 to 50 again, and more than 60 plus, they have to be very conscious while doing all exercise. Okay, while doing this also, if you are 20 to 30, you can do like this. 1, 2, 3, 4. So it will help you to reduce fast rate because you are young, your muscles is good. Even if stiff, you can develop very easily. But after 40, after 50, your bone intensity decrease, your muscles elasticity is decreased. In that case, you cannot give so much pressure to your muscles. Okay, so this is the front stretch you can able to do, and then rotation, your hip rotation, hand on your waist, leg out little less, only hip distance from here to here, only hip distance on your between your both feet, hand on your waist. Now do circle. First inhale, exhale while going front. Inhale again, exhale like this. 5 times clockwise, 5. Relax. Same goes with your knee, but if you have any knee injury, knee pain, in that case you can avoid the knee rotation. Close, joint your both knee and then inhale. 1, inhale. Now anti-clock, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Last inhale, exhale, relax. This done, waist, knee. Last one is ankle. Ankle, leg, little up. But when people are doing ankle rotation, this is the ankle rotation pattern. They are doing like this. So here is not your ankle, complete leg. Only do ankle rotation. This. 5 times clockwise, 5 times anti-clock, like this. If you're not able to hold, you can hold your wall and then another leg. 2, 3, 4, 5. Anti-clock. 2, 3, 4, 5. So this is, so all joint is open. Now do hamstring stretch. Hamstring stretch, for here you have to do kick. Kick will give you so much good hamstring here because exercise preferred time is morning. When you sleep for 8 or 9 hours or 7 hours, in that time your body will be complete relaxing mode. Your all joints is relaxed or it become little stiff as well. So in that case, morning complete joint opening and joint warm up is required. So this will lead this neck, this one, shoulder, chest, side waist, then circle, your lower waist, knee, ankle, now hamstring muscles. Hamstring muscles, hand, straight, right hand, and you can do the cross kick because similar kick is also you can do, but cross kick will give you the stretch to your side thighs as well. Even the center, this lower thigh and the side waist. So cross kick is like much preferable than the front kick. Hand and cross. 1, 2, straight. Many people are doing like this kick. Don't do this. Otherwise, you will get the knee pain very easily. Leg should be very firm, very straight, and go. If you are reaching here, that is fine. No need to reach here. If you're reaching here, that is okay. But your leg should be very firm. We'll do 5 count both. Hand, right hand, left leg. Cross kick, another hand on your waist. Inhale, exhale out. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Another side. left hand, right leg. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Last, inhale, exhale. This you can do at least 10 times. Will help you more. 5 times is not. 5 times is like just opening your hamstring is not open also completely. You have to do at least 10 times with each leg. The same time, focus as much you can stretch. Don't do the hyper stretch in one day, and second day you don't want to do only because your body muscles all everything is locked, and next day you don't want to practice exercise. While doing yourself, if you have any trainer, well and good. But if you're doing by yourself alone, in that case, surely you're not going to get up from your bed. So better do in a slow manner. Give yourself to motivation and do regular exercise. One day exercise is not going to help you. Okay, this is the warm-up pattern. This done. At least this much warm-up if you do every day, so that is sufficient. Pranayama, which I added initially 3 pranayama. This exercise, the breathe, this all warm-up, that is. And now I'm going to introduce few asanas, some standing asana and some floor exercise. So that asanas will help you to complete your this yoga session or yoga day if you doing every day yoga routine, so that's going to complete this routine. First asana is called Tadasana. It's very famous asana. Many people know this Tadasana. It's preferably very much preferable asana while get up from the bed. Many people are doing by default. They don't know they're doing asana. They get up from bed and they do just this. That is actually Tadasana. People are doing for just relaxing their body. Yes, Tadasana helps you to stretch your body completely. So one of the best asana to stretch your all muscles. At the same time, when you breathe and hold your breath, it gives your lungs also a good oxygen level. Okay, maybe you are able to see me completely. Yes. Okay. Now put together, body straight, hand joint here first. Keep it here. First inhale. You can do the two manner. First you can do inhale and up and do normal breathing. If your breathing is good, in that case you can hold your breath at least for 10 seconds. Inhale and stretch up. Hold at least for 10 seconds. This you have to repeat at least 5 times. Here, I'm not going to practice 5 times completely. But you can practice at least 10 seconds, 5 times, or gradually you can increase your time 10 seconds, 20 seconds, 20 seconds to 30 seconds. If you're very nice in that time you can try to hold for 1 minute. Okay, this is the best pranayama to stretch your complete body. Second one, yes?
Yeah.
Okay. Second one is seated Tadasana. Same like Tadasana. Here you have to give 1 meter distance. In Tadasana, we are doing leg joints. Here, 1 meter distance, not too wide, only 1 meter. Both hand again, join, inhale. Here, no need to lift. Here, only inhale. Exhale down. And look, sorry. Inhale, exhale, down, and look up to ceiling. Here, this is the posture, and you will feel the pressure on your lower. If you feel more pressure than usual, you can lift little bit only, not too much. If you feel not pressure here, in that case, you can Stretch more. Inhale. And look more down. As much you can go. Hold at least for 10 seconds each side. And repeat at least 5 to 10 times. If you're doing this much asana, so in that time you have to repeat all the asana at least 5 to 10 times. You can do everything?
Yeah, I can.
Okay. Now leg spread, hand and heel down. Hold for 5 seconds, 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Inhale. Now stretch another side. Inhale, exhale down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Very nice. This you can practice at least 5 to 10 times. As much you can do. If you do very few asanas, try to do at least 10 times each posture. So then only it will at least 50 to 1 hour session for yourself. This is the 2 asana. Now we'll do Utkatasana, squats position. Many people know squats, but many people are doing wrong posture all the time. Because I am seeing people first squats. Yes, you can do in all manner, leg spread, this thing, squat is this squat is also there. But normally you have to start with little hip distance and toe is facing front. It's not facing like this. Don't do squat like this. Always your feet facing front while doing front squats. Squats is variation, so much variations is there. First start with the front squat. So in that case, both feet facing front. Body line will be in one line. Hand, inhale, you can keep letting your shoulder or your hand in one line. And inhale, here you have to first inhale while inhaling down. And hips back. Like you're sitting one there. Inhale, down. In that case, you just sit like this. Body, mind straight, body straight. If you many people not able to go back, they just leaning forward. They just bending their knee like this and do squat like this. So this is the wrong position. How you come to know you're doing wrong squats or right squats? In that case, while sitting, if you're able to see your big toe, means your squats is right. If you're bending your knee, you're not able to see your toes. In that case, you're doing wrong. So this is the one trick. So you come to know you're doing right or wrong. And same with the wrong squats. Gradually you can increase the knee pain. That is again a bad posture. Otherwise, squats is very good for back pain. But yes, if you have exactly back pain, in that case, don't do. If you have like severe back pain, in that case you can do squat with wall support. Same hand, little distance, then inhale, go down with wall support and then go down. And up, like this. Okay, we'll do inhale, go down, hold at least for 10 seconds. Inhale, exhale down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. One more time. Inhale. Exhale down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Up. It's okay. Repetition is, yes, tomorrow is there, right? No need to practice completely today. Today is Sunday. Okay. So this is the 3 posture. Now 2 lying down posture I'm going to add. So again, one of the best exercise for the lungs and the same time back pain because when due to corona and due to this people are sitting in their chair and their laptop at home. Very bad posture, so they all develop the back pain. Previously it was office also they developed back pain. Yes, at least they are here and they are roaming. So in that case it is okay. But here at home, all the time they are sitting, they are working, that time they are sitting. Going here and there is completely out. So in that case they develop back pain very nicely. So in that we will practice little 2 exercise more for back pain. First, lie down on your mat. First sit in Tadasana. Now lie down completely. Then hold your leg one by one. Hand you can keep here. If you're able to lock your heels, you can lock. If you're not, you can keep your hand by the side as well. This asana called Setu Bandhasana. Setu Bandhasana is very beneficial for your lower back, your chest, your shoulder, any cervical issue. People can practice Setu Bandhasana. Inhale. Exhale. Here you try to hold your breath at least for 10 seconds. Gradually you can increase the time. First inhale. Same. You have to do at least 5 to 10 times. And holding again 5 seconds to 10 seconds. Inhale. Hold. 1, 2, 3 more up. 5, 6, 7, 8, 9, 10. Slowly down. Relax. Now last one we'll do Bhujangasana, Cobra pose. Here's first lie down on your stomach. Completely. First, completely relax. Then put your both palm on your last rib cage. Here. Chin touch. Elbow join to your body. First inhale. Look up to ceiling. Here, don't get up like this. Many people get up like this. Don't get up. Here, you have to get up to your knee width. Then hold 10 seconds. Exhale. Inhale. Exhale. It helps you to decrease your upper back pain, lower back pain. Same time, it helps you to reduce if you have any shoulder pain, shoulder issue, cervical issue. It helps you to reduce that pain as well. So this is the posture every you practice. Inhale up. Hold. 1, 2, 3, 4, 5, down. Again inhale forcefully. 1, 2, 3, 4, 5, down. Because this is not a practice session, so I will just do the 5 counts. You can try to hold at least 10 seconds to 20 seconds, as much you can hold. Or you can do the repetition at least for 10 to 15 or 20 times. If you do only 5 asanas, I introduce 5 asanas to you. Tadasana, Diryak Tadasana, Utkatasana, that's squats position. Then Setu Bandhasana, bridge pose, and this Cobra pose, Bhujangasana. These 5 asanas will help you a lot too if you practice at regular days. Surely I wanted to continue and coming live in future as well. In that time, I am going to introduce more asanas, which is help to like develop your flexibility. And sometimes, yes, many people want to reduce their uh, weight. In that time, this much exercise is not enough. So many exercises are there. So in the, once you practice this much, at least you get used to with this, then I'll come with the, some more difficult asanas and little more advanced asanas as well. Okay, and if I have any question?
I think they won't be having. But I just want to tell something. Initially, when I just started this yoga, I couldn't bend down and touch the floor actually. But after a week of experience, I just started to touch, and I can also go back and hold my breath for 10 or 15 seconds. So don't like give up immediately if you start yoga. You cannot do means you don't give it up. Please keep trying again and again. See, for just I think for half an hour or something, I get a lot of sweat over here. So it's obviously better than a gym because you feel more energized and more active after doing a yoga. So please practice yoga so that you are safe and stay safe because since it's a corona time, she taught quite a lot of pranayama. Please practice that daily so that you are away from the viruses and you can be safe too. Anything else, Vandana, you want to say?
No, that much only I have to say because see, regular days I have my friends, I have my clients. I'm very like busy and occupied with all. But I've always wanted to do something with other people who like learn something from yoga. And many people are doing so much things for this. That's why I want to do something. So at least I also do some contribution for my side. So that's why I added exercises and the things. So people are at least utilize that thing and get benefit. At least the infection and the dying rate should decrease. You won't believe every day I'm seeing the news and every day I'm seeing so many people are dying, so many relatives, like my own relatives. So I heard so many news. Every day some people have this problem, that problem, and every day that news comes. So it's very scary. So I want more and more people do exercise, do yoga, stay fit. So at least this death rate, at least I'm not going to hear this count, so much count every day. Please do exercise. The young people are normally using Insta, old age people are not using that much. So I'm requesting to all the youngsters, please introduce yoga to your family and to introduce yoga to all the young, your old age people at home who don't want to do. Till that time, they're not going to suffer something. So please pressurize them to start something, give motivation to them to they are doing exercises because maybe in young people have some immunity, they can survive. But old age people, they don't have. So in that time, please introduce your family members to do some exercise, do some regular pattern for your kids because nowadays the third wave is going to start. They are normally attacking to the kids. So maybe you don't have kids, but yes, your relatives have kids. So please motivate them to start exercise or pranayams with your their kid. And if you have your kid, please introduce with them as well. More than 3 years old kid can do exercise. My own son is doing exercise, so many exercise. If you visit my page, he's doing so much. He's doing plank, he's doing this mountain, all type of exercise, breathing exercise he's doing. So please, if you introduce, yours we will do. And kids are very good for copy. If you do, they will do for sure. If you are forcing them to do this, they will not going to do. If you practice every day, they're going to sit with you at least and they practice by default. Because this third wave may be going to take another 3 in this 2021 as well. So please stay fit. Please don't the corona is like reach to your door. And the same time, if you're doing exercise, you're very fit. Doesn't mean you can like allowed to go outside. Please stay at home. Be safe. That's it. I'm trying to connect more. Yes, thanks to my friend Revati. Like she's my, of course, she's my student, but one of the best friend. She's always
Yeah.
motivating me, Vanna, you do something like that. So thanks, because of her only I feel motivated here, because I'm not that person who's doing these things.
We will do again.
Okay,
Again very soon we will do.
sorry.
Very soon we will do again.
Sure,
Another
we
time.
will. Then bye bye. See you. How
Bye.
to go. Bye bye. Take care.